Cording in the armpit, which is also known as axillary cording or axillary web syndrome, occurs in up to 86% of women and men following their breast cancer surgery with lymph nodes removed or biopsied. So it's incredibly common, but yet not talked a lot about. My name is Kelly and I'm an oncology physical therapist, and I'm also a certified lymphedema therapist. And today in this video, I'm going to go and explain exactly what cording is, what causes it, and treatments for it. Before we begin, make sure you subscribe down below for weekly new videos. You can check out our Instagram for more related content, and you can check out our website for more resources. Axillary cording usually shows up 2 to 8 weeks after surgery, but it can show up weeks or months after this as well. For some, they may have a cord and it can go away, and then another returns months later. Although this is less common, it can happen. What does a cord look like? It shows up directly in the arm port as a tight cord, sort of like a guitar string. So when someone tries to lift his or her arm, it pulls really taut and may stick out even further and be more prominent so you can visually see it. It can run just in the armpit, it can run down to the elbow, and it can even run down all the way to the wrist. They also may show up in the chest wall or the breast as well. It just depends person to person. Who gets it? Like I mentioned, studies greatly range, but they have shown up to 86% may get a cord throughout this process. Those who have more lymph nodes removed, like with an axillary lymph node dissection, are more likely to get a cord compared to those who only have 1 to 3 lymph nodes removed for a biopsy, such as a sentinel lymph node biopsy. And it's not clear why, but they are also more common for those who have a lower BMI or body mass index, and also for those who are younger. What causes cording? To be honest, the medical community isn't 100% positive what causes cording, but it's strongly thought to be a lymphatic vessel that is affected in the surgery, hardens, and gets bound down under scar tissue, and it's inflamed. It can cause tightness and issues with raising the arm or movements, and for some, it can be really painful. How is it treated? Cording for many will resolve on its own. For most, the cord will go away within 3 to 6 months. However, there are times that the cording will persist for individuals for years after their surgery. So rather than waiting to see if it goes away, we can be proactive in treating this with physical therapy. Treatment may consist of manual or massage-like techniques to help soften that scar tissue, to help release the cord from being bound down by that scar tissue or fibrotic tissue. We will also teach stretches to mobilize and release the cord, along with nerve glides or nerve mobilizations. The general goal is to release the cord from being bound down. So if it's bound down and you try to lift your arm, it's going to get so taut that you may not be able to raise your arm as high. And again, for some, that can be painful. So we focus on treatment for this specifically. Because they may take time, we will teach these individuals how to do these treatments, the soft mobilization techniques, the exercises, the stretches, the nerve glides on their own safely to help improve symptoms as quickly as possible. So I have a couple of videos on my channel that show a few of these exercises and a few of these techniques. But if you want to learn more of these techniques and go more in depth on how to get rid of cording, then you're definitely going to check out my breast cancer rehab program. For years, I saw how little guidance and support there was for women and men with their cancer treatment. Yet these issues like the pain and the cording would linger on for months or years later. So I've been treating these issues and working with patients one-on-one for over a decade now, and now I'm trying to share all of these secrets and techniques with as many people as possible. So I have created a full program that guides you all of the aspects through recovery, from lowering the risk of getting breast cancer-related lymphedema, getting your range of motion back, reducing pain, and I specifically have a section that goes in depth on how to treat axillary cording. I show all the manual techniques in detail with demonstrations in the same way I teach my patients in the clinic. So if someone has a cord that you are struggling with, then this is a perfect option for you. You can get access to the entire program, or you can choose just the topics within recovery that you personally need help with. So for more information, head over to my website, which I will link in the description box down below or as well as up above. If you have direct access to an oncology physical therapist in your area, that is also a really great place to start. Cording can be stubborn and frustrating, and it's something that, yes, is common, but it's not normal, and it's something we can address to help you get rid of it. For more topics related to breast cancer treatment recovery, you can check out my website for more resources, and as well as the other videos on my channel on axillary cording. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.